Good evening, everybody. Welcome on in to another medical talk in layman's terms with Nurse Charlene. And tonight's topic is near and dear to my heart. It is understanding cancer and its anatomy. So I'm gonna try to get through both, but I may only get through the first part of it, and that's just understanding cancer. If I'm able to, and we're lucky enough, I'll try to get through the anatomy and just give you a little bit of what cancer really is, that it's not a big deal in that way and stuff, and that it should not be praised, but it should be um, definitely looked down on, because that's what it is. It's garbage and everything. So y'all welcome on in, and definitely, I get pumped up and I get, nice and comfortable once I see my peoples come on in and stuff and start watching and everything. So let's see how it goes and stuff. So I'm gonna start off with my podcast disclaimer, and then I'm gonna go into the first part of the topic, which is understanding cancer. And hopefully I'll be able to end with and its anatomy, cancer's anatomy. Anatomy means to tell you the parts of cancer and why they look bad. So one more thing I got on there is the what is it? The sorry you guys and stuff is my pictures in the back. And so I went out my way to explain, cancer as far as what a normal cell would look like, and everything and stuff. And that would be these little bad boys right here. This is what we want to have in our body. And cancer, this is what it does. And I'll explain that in detail. So it's going to be in layman's terms, because it's medical talk in layman's terms with Nurse Charlene and everything. So I'm going to explain why cancer is the way it is, and everything, and as much detail as I can, just, making no mistake in everything of what it really is and stuff. I thought I was going to be able to, oh, okay, now it's letting me in, okay. Because I think I see you, Kiki. Welcome on in, my dear, and stuff. Sure do appreciate you coming on in and stuff. You guys know y'all pump me up when you get on and you get to commenting and stuff like that, and it's okay. This is a safe space. Nobody is putting down nobody, not on this podcast or anything and stuff. And we just like to get on in and stuff, and we like to talk about stuff that nobody talks about, so that we can get to the bottom of it and everything and stuff. So like I said, like, tag, and share. I'm on YouTube simultaneously. So right now I'm on YouTube and Facebook Live at the same time, streaming to you and stuff, so that I can reach as many people as I can and everything. So I'm going to start off with my podcast disclaimer and stuff, because this helps me continue to give you this without making myself accountable to whatever rules and regulations are out there. I want to make sure that I'm covering them and stuff. So it says the purpose, the podcast is for informational and educational purposes only. It is not intended to replace professional medical advice, diagnosis, or treatment. Always consult with your physician for any medical concerns. If you have questions about a medical condition, reach out to a qualified healthcare professional. Never disregard professional medical advice or delay seeking it because of something you heard on a podcast. Not just this one, but any podcast. Never delay treatment or seeking it and stuff. So then we have guest views are their own and may not reflect the views of the host, which is Nurse Allen, or Nurse Charlene rather, and or this podcast. The information shared is for general knowledge. It should not be used for any legal or medical purposes. Yes. So I like to add this in and stuff. I can't help you with your lawsuit, But if it's in good faith, I hope you win. Okay. Always consult with a licensed professional who knows your medical history for a meaningful evaluation. They got to know your medical history. If they don't know nothing about you, you're just like anybody else that they pass in the hallway and stuff. You got to be precise. Stay informed, but always seek professional advice when it comes to your health. So it's okay to research for your health and to research for your life or whatever you're going through or your family's going through. It just means make sure you staying informed and you're getting good grain, you're getting good information and everything. Welcome on in, Miss Sandra. Thank you for coming on. All right. So I'm going to go to the first part of it, which is understanding cancer and all its loveliness. Okay, not lovely. Okay. But oh, and also welcome on in, Miss Kiki and stuff. I see you there and everything. Y'all come on in, make a comment. You don't have to do it right away and stuff, but whenever you're ready and stuff, and that's fine. So I'm just gonna give definitions right now and stuff, and this just warming up. Cancer is a disease where some of the body's cells grow uncontrollably and spread to other parts of the body. Okay, I'm going to repeat that one more time. Cancer is a disease where some of the body's cells grow uncontrollably and spread to other parts of the body. It's a gremlin. I don't know anybody that knows that. I probably date myself. I don't care. I really don't care at this point. There's too much going on for me to be caring about my age or whatever and stuff. I'm giving you the good stuff. Good evening, Miss Sandra. She said, good evening, Nurse Charlene, and everyone else on board. Yes, yes. Good evening, Auntie Linda. Good to have you on. Yes, definitely. So then the next part about it is normally cells grow, divide, and die. That's the circle of life. Welcome on in, Liddell. Good to see you on. Thanks for coming on. That's normally cells grow, divide, and then they die. That's the end of their circle of life. And that's what they're supposed to do. Cancer cells keep growing. They don't die when they should. And that becomes a problem, a real problem. So you see, cancer doesn't even get to be all complicated and all fancy and stuff. It's a hot mess, but it's just a cell that doesn't know when to sit down and have a back seat and take a seat and go die somewhere. It wants to keep on going and it wants to trash the spot or trash the host. Guess who's the host? You and me. We're the host and stuff. And they just want to trash us and eat and eat and eat until it destroys us. It's so mean and so ridiculous and stuff. But that's what it's trying to do. That's what the purpose is. It wants to eat and eat and eat. And guess what it gets to do? It gets to die right along with you. So what are you doing? What are you accomplishing? If you trash the spot, if you bite the hand that feeds you, if you destroy the hand that feeds you, the body that feeds you or whatever and stuff like that, then at the end of the day, y'all both die and stuff. And that's the end of it. So it's nothing good about it. It's nothing at all. Okay, Liddell said, good evening, Miss Charlene. Thank you, Liddell. Good evening, my dear. And stuff. And so the other thing is, I said normally cells grow, divide, and die. That's a normal cell. A cancer cell keeps growing and doesn't die when it should. And that's why it gets to trash the spot. It's a hot mess. I'm mad at it. I don't like it. And I never was fond of it from just knowing what it does and everything and stuff. So then we got these cells can form lumps or tumors Or another word you might have heard is lesions. If you've ever been around somebody with cancer and stuff, they call it tumors, lumps, lesions, whatever it is, it's cancer, and it's a hot mess. I have nothing good to say about it. Anybody does, nobody's pro cancer. But anyway, I'm not going to be talking good about it tonight and stuff, but that's just me, and everything. And I'm pretty sure I'm not alone and everything. So just getting to common types of cancer. So I just told you what cancer basically is. It doesn't even get to be exciting or fancy smancy or nothing like that and stuff. It's so basic and stuff. But that's what it is. A normal cell is these two right here. They got like a nucleus and then a couple layers around it. So that's why the circles are there. It's not eyeballs. It's just like a cancer. I mean, a regular cell looks like this. This cancer cell looks like one of these, just one rogue cell. And it's sitting there looking dumb until it keeps knocking on the door of the normal cells because it wants to get in, and then it changes the DNA of a regular normal cell, and then it starts replicating out of control. So if you see right here, this is a cancer cluster or a lump or a lesion or a mass or whatever they want to call it, a oma, a tumor, or whatever and stuff. That's what it is. It needs to be a gang and act a fool and stuff. So that's why I got all these partners with it. And it's trash in the spot. Wherever it's at, it's trash in that spot. And you can count on it. I just watched this movie, Colombiana, the first one that she came out with. I guess it's a part 2 coming out, but Colombiana. And at the end, she put the dogs inside the van, and the guy thought he got away and stuff. And then she talked to him for a minute, and then she told the dogs, eat. And they tore it apart. That's what cancer does. It eats. And it's going to tear it apart. And then guess what? That person is no longer. Unless. So we'll talk about that later and stuff. So good evening, Tony, cousin Tony and stuff. She said, hey, cuz, I'm here. And someone just knocked on my door. And oh, my God. Yes. You lost your wallet and stuff, and somebody returned it. Now that's what I'm talking about. That's God being good right there and stuff. But thanks for coming on and stuff. I appreciate you and stuff. So I'm now on. Okay, let's do a re-entry. Welcome to Medical Talk in Layman's Terms with Nurse Charlene, and the topic tonight is understanding cancer and its anatomy. So that's part 2. If I get a chance to get to it and stuff, I'll do a little bit of anatomy. But I'm already giving you some anatomy right here because it's normal cells in your body. We want these. We want lots of them, and everything. Cells are good. A rogue cell like this, it starts off with 1. And then, like I said, I brought up the movie Gremlins. They threw the water on I forgot the name of the main character and stuff, Gizmo or something like that. And then all these other little gremlins start popping off. That's what they're doing. And then what did the gremlins do? If anybody remembers that movie, they start trashing the spot. They start getting everywhere. They was in the toilet. They was everywhere. They was in the shower. They was in the oven. They was in the microwave. They were everywhere and stuff. That's what a cancer cell does. Once it gets into one of these good cells and starts replicating, it doesn't die like a normal cell would do and stuff. It just keeps on proliferating and tearing up the spot and trashing the spot. And guess what it wants? It wants you dead. And guess what? It gets to die with you, but it wants you dead. So that's what it's there to do. It's to kill, maim, and destroy. And that's what cancer is and stuff, if that makes sense. So now I'm going to tell you about common types. Now, make no mistake, cancer is what I just said, but the types. So it depends on where the cancer starts its replication or starts its division at to make this big old gang right here or gremlin area and stuff like that. It gets a spot. So it's wherever it starts at because it's looking for an opportunity. It's a trashy, toxic, opportunistic cell, mutant cell. Once it's able to replicate itself and keep on dividing off, it stay in that spot until it destroys everything in that area. That's why we say cancer kills and that it's so horrible and oh my God and everything and stuff. Because then now it's looking for another spot because it didn't do bad enough with the one spot. So now it wants to find another spot and everything and stuff. So now I'm going to tell you common types of cancer. This is not all of them. They're everywhere. Everywhere you got a part, there can be cancer because there's skin cancer. There's, there's eye cancers. There's, different bone cancers and all of that stuff. But some of the most common ones is your breast cancer. And we all know about that one. Then and that's for women, because women have breasts and stuff. So breast cancer. And then prostate cancer. That a man has a prostate and stuff. So then it's prostate cancer. And then there's lung cancer. We all got lungs. So lungs will pick anybody that wants to smoke, and stuff like that. Often linked to smoke, but that's not a definitive way that you could get lung cancer. Because lung cancer can start off somewhere else, like in the breast, and then make its way somehow to your lungs. And then it's lung cancer with the start of it being breast cancer or whatever it might be and stuff. It's looking to travel. So it's going to travel by any means, by the blood system, by the immune system or whatever. It wants to jump on that freeway after it destroyed everything in the area where it started at. Then it jumps on the freeway and goes somewhere else. Welcome on in, Auntie Josie. Welcome on in and stuff. Then you got, like I said, the lung cancer. Then you got colon cancer. Everybody has a colon. It's actually interchangeable with large intestine. So you got small intestine first, then your large intestine, which is your colon. And then that's the GI system or gastrointestinal system and stuff. So the colon is a part of your large intestine and a part of your poo-poo tract, your boo-boo tract, whatever you want to call it, stool tract for our nurses out there and stuff. But I don't know, dookie tract. Yeah, you get the idea and stuff. But I'm just trying to make sure that I keep it in layman's terms. That means keeping it simple so that somebody that doesn't know all the big words and stool and urine and stuff knows that stool and urine means poo-poo and pee-pee, and stuff like that and stuff. Everybody got to get a chance to learn this because they might save their self by accident too. Just because you don't know doesn't mean that you shouldn't and everything. So there's also another one. And this one is not where all the other places like bone and skin cancer is and stuff. It's called leukemia and stuff. And that's a part of the blood system, one of the cancers of the blood and stuff. And that's where it floats around inside your blood. And it's a really bad one and stuff. And a lot of children get it also, and then they grow up to be adults with it, and stuff like that off and on and stuff. But however it is cancer, and it's a hot, toxic mess. Yes. And Tony says secondhand smoke. That is correct. The lung cancer is often from secondhand smoke. So you don't necessarily have to be the actual smoker. You could just be in a house with a 20, 30-year smoker, like the wife and the husband is the smoker, or the husband is the secondhand one and the wife is a smoker, chain smoker or something like that and stuff. Josie said, my family has a history of breast cancer, colon cancer, lung cancer. So I always let the doctor know. Absolutely. So then I say, I know y'all done heard me many a times. I even did a whole podcast topic on your body's a snitch, believe it. That's where that comes from. You see how it's ringing true on everything I talk about? Everything I talk about. If I tell you a symptom is your body's way of snitching. It tells you by doing this, by giving you that headache, that you got high blood pressure, by making you thirsty and have to pee and very hungry, that you got diabetes, and stuff like that. It's always a symptom and it does this, that, the other. So what we got to do, including me, I'm a nurse, so I already know if you're nauseated, I can give you some stuff called Zofran and stuff, and that'll stop the nausea. If you got a headache and stuff, I can give you some stuff called Tylenol or Motrin if you can't take Tylenol, or vice versa and stuff, and that might stop your headache and stuff. If you're swollen, and stuff like that, or swelling in your knee, your back hurts and stuff, we give you this. But why is your back hurting? Was it always hurting, or was it just hurting recently? You pulled something. So when you look at it that way, and stuff, definitely you'll start seeing why I say these things over and over, because that's what they are. The signs and symptoms are what they are and stuff, but that's your body's way of saying, hey, you gonna cover it up with Tylenol? Hey, you gonna take that Zofran, the little fancy medicine, a nurse, you gonna take that. What am I doing? In my case, I'm masking, but guess what y'all doing? The same thing and stuff. I got that headache. Oh, it'll be all right. I'll just take me a couple of Tylenols and stuff, put a little ice pack. Did you find out why you got the headache? Because it might just be something simple, but then it might be something really bad, and stuff like that. Do you know there's a such thing as brain cancer? Why my nose just always running and stuff, and I get bloody noses all the time and stuff, and my ears is hurting, my eyes hurt and everything and stuff. Yeah, you might have that. So what do? You didn't have this all these years and stuff, and you've been taking Tylenol. After a while, it's gonna turn up, because cancer, it want to be recognized. Like, hey, like I'm me, and so I'm cancer and stuff, and you don't want to listen to it. Is, oh, okay, you gonna either F around and find out, or you gonna mess around and find out. I'll let you be the choice of that, the pick on which one you want to find, which way you want to find out. Okay. Tony said yes, because your body is a snitch. Absolutely. And stuff. So going to signs and symptoms that you may have cancer, and listen to the signs and symptoms, because they're not going to tell you like, oh, I know that's cancer because it did this, that, and the other and stuff. Guess how vague they are and stuff. I'm going to tell you. Unexplained weight loss. What if I'm taking those Ozempic or something? Or what if I just don't want to eat? I don't like food right now and stuff. And I'm fasting, but I didn't consecrate nothing and stuff. I'm just fasting to be fasting. Okay. But unexplained weight loss is one of the big ones and stuff. Then also lumps or swelling. So we get a lot of swelling. We get that from arthritis and everything and stuff. Tell on it. It might just be arthritis. But what if it converts to something else, because the swelling is caused by a rogue cancer cell down by your knee or down by your lower back? And now you got bone cancer or something like that. You see what I'm saying? And stuff. It's too vague to just put as, oh, I know it's cancer. Just because your leg is hurt. No, it ain't always just cancer. But when you want to find out, your body is crying, is yelling. Find out what it is first. And then you can choose to ignore it or treat it or figure it out, and stuff like that with the doctor's help. With your doctor's help. Not Nurse Charlene. Nurse Charlene is trying to coax you into the doctor. I'm trying to slightly push you into the doctor. Go tell on it. Go tell on it. I can't fix it. I ain't got no x-ray in my eye, in the back of my eyes or nothing. I can't fix it for you. But I can tell you where to go, where I would go. Remember, I'm a nurse, but I'm a patient. I work with the doctors, but I'm also a patient, and stuff like that. So if that makes sense. Okay. So I said unexplained weight loss, lumps and swelling, persistent pain, that little side pain, it can't always hurt. That little back pain and stuff, it can't always hurt. A little bit of chest pain, it can't always hurt. It might be a heart attack, but then it might be some type of cancer, but then it might be something else. But wouldn't you want to get on top of it before you go into an agonizing death, and then you don't even know what happened because it ain't even common in my family? I'm gonna get to it. Okay. Unusual bleeding from anywhere. So that's the nose. Remember I said the unexplained nosebleeds. Well, that's because I'm a hemophiliac. Well, it might be that. So make sure that you got your factor X or whatever and stuff, or your medicine for that. You know, your vitamin K shots that help stop you from bleeding and help you clot a little bit better and stuff if you're a hemophiliac or something like that. But what if it's some type of cancer? Okay. I'm excited, you guys. I'm getting it together and stuff, but I'm pumped up and everything. So these are signs and symptoms and everything that I'm talking about. Chronic cough or trouble breathing, that cough that just never goes away. Do you always got a cold? You know what I'm saying and stuff. So just think about it and stuff. I've been coughing for months and months. Oh, make that years and years and stuff, and everything. And you never want to find out why. I don't think it's normal to always cough. Yeah, if I got an allergy, and it's seasonal or something like that. Yes, if I actually got pneumonia or some type of cold or flu or something like that. Yes, for this. Yes, for that and stuff. But what if it's something else? What if your lungs are being compromised? Well, you want to catch it, and stuff, because guess what? You might can do something about it. Don't let it take you. Okay. Changes in skin. Don't sleep on them moles. Now I got 15. I only had like 3. And now I got 15. I got one right here, one in the back of my neck, a couple on my arm. Where these come from and stuff? I thought it was this or I thought it was that. Watch it. It's giving you signs and symptoms. It is snitching. Snitching means signs and symptoms. Not snitches get stitches. Snitches mean signs and symptoms and stuff. Also, fatigue that doesn't go away. Okay, we already got over COVID. Some people might have caught 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12 times or whatever and stuff. But you can't always be fatigued. You can't always be, I have no gas. Like, you don't get no gas. Do you eat? Like, something's wrong. Something's wrong and stuff. It's not your body. When it does something abnormal, you shouldn't always have a fever every day. You got an infection somewhere. It's about 100% chance, 150% chance you got an infection. If you always got a fever, I ain't talking about menopause or mental pause. I'm talking about you're hot and you got a fever. And sometimes you're so hot till you cold, and stuff. Your body is not regulating. Something is causing it to be that way and stuff like that. You got to tell on it. Stop letting these things get away with this on us. I'm talking to myself. So when I'm yelling at you, I'm yelling at me. I'm looking at me, yelling at me, and stuff. So I don't know how else to explain it, but I'm going to just keep on going if that's okay with everybody and stuff. How is cancer diagnosed? How is it diagnosed? A physical exam and medical history. That means, guess what? You got to actually go to the doctor. You got to actually go to the doctor. And then it says not just that, but a medical history. That's when you got to go to the doctor and you got to snitch on your family. My uncle on my father's side had some this and that and that and this. My auntie on my mother's side had that, this, and the other. My mother had it. My father had it. My sister had it. My brother had it. My, whatever it is, tell on it. The more you tell and open yourself up to it, the better chance you got at getting to the good part. Yes. And so welcome on in, Miss Maria and stuff. Good to see you. Thank you for coming on. You said stop being afraid to address the issue. It can be scary, but if you have a fighting chance, take it. That she just said what the words that are coming out of my mouth. If you got a fighting chance, when you want to actually fight it instead of I just give up, I'm gonna let it take me. It ain't your choice to just let it take you. You got family. Everybody is attached to you. Your mother is attached to you. Your father is attached to you. Your kids are attached to you. If you have any, your nieces, your nephews, if you don't have kids or whatever and stuff, your sister, your brother, your neighbor, people are attached to you and stuff. And so it ain't right for you to just give up. I guess I'll just let it take me out. And no, it ain't no, I guess you just because you caught it late, at least do whatever you can. And you better if you want to take that stance, get your household in order so that you're not leaving everybody with the burden of taking care of you in the end and everything and stuff. Maria said generational diseases. Welcome on in, Uncle Ricky. Yay. And you said, we don't holler at ourselves enough and take the snitch for granted. Yes. And so meaning we don't check ourselves and stuff and look at ourselves. Our bodies is trying to tell us, hey, the reason why you cold and your limbs are cold all the way down to your feet and your feet is ice cold is because you might have a circulation problem. Or if you always, when you sitting up and stuff and you swell down there and you need to elevate your legs so that the liquid can circulate. Why isn't it circulating? Why are you swelling every time you put your feet down? That's a problem. You got to tell on that. And so let's get the doctors to making their money instead of making their money and going on vacation for months at a time and stuff like that with their family. And they offer your insurance money, and stuff. And they live in large and stuff. They want to have something to do. They don't want to be bored and talking to just one or two people that know some medical. Learn about your body. You become the expert in your body. It's your God-given right, but it's also your responsibility to become your biggest advocate for you. Because guess what? When you go, you the only you. It's only going to be one Charlene. It could be another Charlene Allen and stuff. And it could be another even Nurse Charlene and stuff. But that Nurse Charlene will never be me. Even if I had a twin, it would never be the same as me. It will never be the same as you. Give your body more credit. Why did you come here? Why did you say, God, release me into the atmosphere so I can go into this wonderful world where everything is wonderful? I'm just saying. Maria said, or certain parts of your body become numb all the time. Yes, that's a problem. There's some type of nerve damage or something like that. It's not doing it. It's not numbing for nothing. Your back ain't back breaking for nothing. Your sciatic ain't sciaticing for nothing. These things are doing this because there's a problem. Hello. And stuff. There's a problem. 911. Okay. And then before I get into the next thing on how it's finish off physical exam and medical history, that means telling on your family and everything they got. Find out what they got and stuff. Find out that they got sickle cell. Find out that they got the trait. Find out that they got this special this, or it's a history of lupus. It's a history of this. It's a history of that. Find out so you can get to the other side. There's treatments that at least you don't have to live in your body and just be miserable every day, day in and day out. If you actually find out what you got. And so you can live at least a better quality of life. You might not want to leave after all and just let it take you. If you find out. Okay. And stuff. So I'll get to that later and stuff, what I had a thought on. Another way it's diagnosed is blood tests. They do blood tests, and there's certain tests that have they call them tumor markers and stuff like that for, cancer. In cancer's case, they suspect that and stuff. They give certain blood tests and it'll show different things, and there's different levels and stuff like that. And it'll show you certain things and stuff like that. So it's different blood tests. I'm not going to go into that because there's so many and everything and stuff. But for time's sake and stuff, there's scans. There's what they call a CT scan, a computed tomography scan. You don't need to know that. CT scan, MRI, magnetic reasoning imaging, and stuff. You don't need to know that. MRI and stuff. And then there's the X-ray. Everybody know that hold yourself out and they take a picture and then they can tell you what's in your chest or whatever and stuff. But those are some of the scans and stuff. And then they get a little bit deeper when it comes into cancer and stuff. There's PET scans and 3D scans and all these other fancy things, that they do and stuff like that. So it goes into that. And then another one that you don't sleep in. This is how cancer is diagnosed. Not all the other stuff, because you could get CTs and MRIs for other things. But another one is biopsies. Okay, now they see something strange. They call it a mass because they can't claim it yet until they actually biopsy it. Because it could be something, if you've ever heard of malignant, which is the bad one, or benign, which is the one that's just sitting there dormant and stuff. We don't even know if it's cancer, and stuff like that. But they're going to watch it. Once they, find out it's there, they're going to watch it, and stuff. But you want them to watch it so that you can be ready. So they be like, hey, it said hello, you ready? And stuff. And you can say, yeah, I'm ready, and stuff. And let's get busy and stuff. But that's a biopsy. And that's taking a small tissue sample of where that mass is to check for cancer cells. So that's why they call it biopsy. A lot of women, and stuff, being, if you got large, breast or even small breast, if you get a lump is a lump. It's suspect. It becomes automatically suspect. So that means they want to get a little piece of that so that they can find out, does it have cancer cells in it? Because guess what cancer cells is? Right here. That's a normal cell floating around. That's what we want to have floating around. And those are in even a person with cancer. They got these normal cells too. But if they got cancer, somehow they got these. And you notice that I put a lot of them, they all clustered together. That's a gang, a gremlin, a monster, a toxic fit. And each of these are a cancer cell. And they cluster together and they just keep on multiplying and multiplying, and they don't die. They just keep on until they trash the area. And like I said, that movie Colombiana with the dogs and stuff, she said, eat. That's what they do. They're eating your body. And guess what? They willing to ride with you, and then they're going to die with you. And they don't care. They suicide bombers. They don't belong. And that's what they do. They eat, and then they find another spot sometime, and they eat that spot too and stuff. Then they find another spot. Eventually, that host is going to wear down, which is you or me and stuff. And then they just eat and eat until you die, and then they die with you. And they good. They live their life then. That's how they die. They die by killing you and stuff. So you see how mean? Okay. Treatment modalities. It depends on the type, the stage, and the location of the cancer. Number one treatment for cancer, to take it out. We don't want it there anyway, because they're going to keep on eating until they destroy the spot anyway. So let's take it out. That's where all of that stuff comes from. So surgery. So it's surgery and stuff. And that's the removal of the tumor, because all these little cells lumped together, clumped together, forms a lesion or a mass or a tumor and all of that, whatever one you want to call it and stuff. So they lump together like that because they're a gang. They can't even be on their own, just roll, because they dumb on their own. But when they get together, they all know how to multiply. But guess what they do? They fight amongst each other and try to tear each other up for the nearest food. It's like the animal kingdom or something like that and stuff. But that's what you call a tumor. And so then surgery, that's one of the top treatments and stuff. They want to remove it because if they get it out the area and stuff, and they get it before it starts finding its way to somewhere else and stuff, you might have a chance to at least prolong your life. we don't know how long we got anyway and stuff. But if you got a chance to prolong it, wouldn't you want to try and stuff? Because that's where this comes in at. So removing it, that's number one. Then there's this thing called chemotherapy. Fight toxicity with toxicity. Chemotherapy, make no mistake, it's there to kill cancer cells. But guess what? It's a chemical, it's toxic. So in order to kill it, it tear up the host too. It's trying to help you by killing them, but it's also a killer, and it's also nasty. So it's gonna help kill it or shrink it or get it to a place where it can be removed, but also it's toxic. So you got to go through the side effects of getting that to get to the other side. But this is the encouragement. If I have high blood pressure, then I might be placed on, once I tell on it, I could just keep it and stuff and then have a heart attack and die. But if I tell on it and stuff, they put me on blood pressure medicine and stuff, and then that'll help control it so that my heart doesn't have to work so hard and stuff. But at the same time, it might come with side effects. So you take this and then you might start itching. You know, I hate itching. But anyway, I'm saying you take this blood pressure medicine, but it might make you dizzy sometimes. It might make you itch. It might make you incredibly thirsty. It might make you crave salt that you should be cutting down on because you don't want excessive salt. So you see what I'm saying? So everything has another side effect to it. So you have acne and stuff. So you take this certain medicine for acne, and then it might make your skin sensitive to the sun. That's a side effect. So now you can't go out in the sun like you would normally do because your skin will get burned quick, you know, and stuff, because you're taking it to get rid of the acne and stuff so that your face is more presentable or wherever the acne might, you know, pop up and everything and stuff. But then also there's a repercussion to taking that. It's with everything you do. If you take, if you've had a stroke before and stuff, that means a stroke is usually a blood clot that clogs the space and a tissue dies in your brain somewhere or something like that and stuff. So then you taking the medicine to prevent the stroke, but then it could cause bleeding. So you survived the stroke and you got rid of the blood clot, but then you got to keep the medicine going to keep your blood thin enough so that it doesn't clot up like that and turn into another blood clot and clog the space and cause more tissue to die. But at the same time, now you're up for bleeding. So you see how even if it was chemotherapy and they told you if they got a treatment for it, wouldn't you want to try? There's never going to be another you and stuff, you know, and stuff. So that's what I'm trying to say with that and stuff. So then I told you surgery, and then I told you chemotherapy, and then there's another one called radiation therapy, and that's a high energy rays to destroy the cancer. So this one is explained to me by oncologists like so. The chemotherapy is one that usually shrinks to destroy it, you know, and stuff like that. But sometimes you might have to go another step forward. Maybe it can shrink it, so then you still got the tumor there. So that means it can wake up again because you didn't already knocked it out a little bit and made it feel bad. You know, now it's mad at you and stuff. So now you got to get it out. So you need the surgery. And then when all else fails and stuff, you get the chemo, you survive it. Then you get the surgery, you survive it. Then you need something else to make sure that it don't come back to that area. So then you get the radiation and it burns the area so that nothing else grows there. It makes the area barren. It makes it where it's not growable for that cancer to come back to that area. It's not coming to visit there. It ain't nothing there for it to visit. You see what I'm saying? So that's what radiation does and everything. So then the way I look at it is, it was explained to me like cancer is a weed. You got nice, beautiful lawn. It's nice and green and lush and stuff. Not nowadays, but anyway, you know, when it was that time where you can have a green lawn and stuff, it's nice and beautiful. You get one little seed of crabgrass or something like that, and then you get a nice little block of crabgrass and stuff. So that's the cancer. So, you know, if you keep on mowing the lawn with that one little piece of crabgrass and stuff, and you don't pluck that bad boy up and out and stuff, that bad boy replicates. And so now you got 2 or 3 spots on your nice lush grass, you know, and everything. Crabgrass is not grass, it's cancer for the lawn and stuff. Then you turn around and that crabgrass, it keeps replicating. So now it's in this spot, it's all the way over there on your line, and so on and so forth and stuff. So then you got that going and stuff. Then you get weed killer and stuff, and that's your chemotherapy. The weed killer, you spray that crabgrass directly into that crabgrass and you kill it, and now it's a big old yellow spot and stuff. Now it needs to be plucked up. That's the plucking it up with the weed whacker or whatever you get to dig that bad boy up and get it out off your lawn so that the rest of your grass turns back green, and it doesn't have that nasty little crabgrass piece and stuff that then jumped around all over and stuff. You know, wherever it could get, it's jumping, you know, and stuff like that. And then you get the radiation. The radiation is sometimes you might have to burn the site. And then you got a little crop circle right there where that weed was. And then you put the chemotherapy, which was the weed killer and stuff like that. And then you radiate the area and kill that little area off. Now you got to put some new green seeds right there on that line, because the weed is the cancer of the line and stuff. And the weed killer is the chemotherapy. And then the surgery is digging it up. And then the radiation is killing that area so nothing else could grow there. And then you dig it up and till the line, you drop some more fresh seeds, and then you get you a nice patch of grass going again and stuff. So could you imagine all of that? That's how I broke it down so good so that I can understand it, so that I can give it to you in layman's terms. Because be it as it may, it ain't that simple, but it is that simple if you understand or medically inclined and everything and stuff. Tony says, this is very good information, and you're explaining and breaking it down very well. Thank you so much. I appreciate that, cousin, and stuff, because people don't know what it is. And the reason why it's called liver cirrhosis, which is another cancer of your liver, you know, and stuff like that, or pancreatic cancer and stuff, which is a cancer of your pancreas, and so on and so forth, is because it's named after the spot it's trashing. It's named after the spot that is being doing too much at, you know, and stuff like that. That's why it's doing that. Yes, Tony, cousin Tony, and stuff. So that's radiation. So I told you about that. And then there's other ones. I'm not going to go all the way into it and stuff, but there's other treatments for cancer. There's immunotherapy, and that's where they boost your body's own natural defense system to help you fight up against the cancer, beef you up, get you strong so that you can fight cancer with your immunity, with your own body's defenses, because your body has a defense mechanism. Your body got soldiers inside of it, and they ready to go at it. That's why it hurts, because they going to destroy whatever they see. Cancer is foreign. Cancer is a stranger. Cancer is something that they don't want. They don't want it in their body, because they know cancer is going to take over and beat them up. So they ganging up on the gang that we call cancer and stuff. So you see what I'm saying? Thank you for pumping me up, y'all. See, this is what I need. Hey, welcome in, Mary. She said, yes, this is great. Thanks for making it clear. Absolutely, Mary. Absolutely. I'm ready for this and stuff. So then we got another treatment modality for cancer, and that is called targeted therapy. And that's drugs that attack specific parts of the cancer cells. That means they're going right in there to get inside of them, because they got inside a good cell to make they cell gang up on you. So now, yes, Alicia, welcome on in, my dear. She said, hype me up, like Glorilla, hype me up, because I'm ready. I'm on and stuff. So then, So targeted therapy, that's the drugs that attack specific parts of the cancer cell and stuff. And these drugs, they cold-blooded, but they do come with side effects. But what drug doesn't? Look at all the drugs you might be on: blood pressure medicine, medicine for a stroke, medicine for whatever it is, AFib, atrial fibrillation, heart medicine or whatever, lung medicine or whatever it is and stuff. And then all of them have side effects. They got to tell you that. You look at a commercial on TV and stuff, and you see, and it says so and so, but the side effects are so, and they hurry up and say that where you can't even catch it and stuff like that. Because everything that's good that fights this, you might have to take a second medicine to fight that. It might be curing this, but then it's messing up this, because our bodies weren't designed to get attacked the way they are and stuff. Mary, she said, yes, right, and stuff. Exactly. Our bodies weren't designed for them. So that's why we got side effects. It's our body's way of saying, "Now, I asked for some help, but I didn't, I snitched and everything, but don't be trying to run up on me and stuff and do this, that, and the other. Now I got to tell on that, and stuff like that." So that's what's really be going on inside your body and stuff. Alicia says, what about stem cell treatments? Is this treatment beneficial for cancer? Absolutely. We have a lot of stem cell and stuff. It's still a work in progress, but it's definitely so advanced now that they're doing it and stuff. So absolutely there's stem cell treatment. It's just that they're not making it. That's the other coin of maybe even a part 2 to this is speaking on that, which is we get the treatments, but nobody hears about them because we can't even afford it. What you got, Alameda Alliance, Alameda Ally, and stuff, or Blue Cross, or Blue Shield, or whatever. What you got, Kaiser? No, I got Kaiser. That's the truth. No, Kaiser ain't the truth. Kaiser take care of Kaiser. I'm gonna tell you that now, and everybody else take care of everybody else. You don't get to be special. I'm sorry, but it's okay. It's the Pastor Mayfield said, right, exactly, and stuff. These insurance, they don't care about you. They care about them. That's why they'll cut your medicine off in a minute. You get too much of this and stuff, and they get expensive. Boom, you got to take another generic. Where you think generic came in at? They don't want to pay for the brand name. There's Tylenol, and then there's acetaminophen. That's all I'm gonna say. Alicia said, or you got to go to another country where the country might be poor, but they get you the best health care in the whole wide world. And then we rich out here and we get the lowest budget, low budget and stuff. Even when I was double and even triple covered and stuff by having several different jobs and stuff, I still couldn't get all the treatments that I was supposed to get, and stuff for different things that I was suffering from. I had to go to this one to get chiropractic care for this and that and stuff, because you got to tell on that back and stuff. You might just need a little bit of popping the most, and stuff. Ain't that right, Cousin Tony? And so you might just need a little bit of chiropractic work and stuff to work out that stuff, pop them bones, pop them muscles, and do whatever and stuff like that. And then Pastor Mayfield said you can afford the medical treatment. I'm not sure. Can you elaborate on that for me and stuff? And then you said, you said, you can't. Okay. Pastor Mayfield said, you can't afford the medical treatment. You're right. That's 100% true. I'm telling you, that's what I'm going through and stuff. Lake Peace, that's what you got. Your name is popping up as and stuff, but I know who you are, Shakari and stuff. You said mom is 70 years old, diagnosed with stage 4 pancreatic cancer, and it spread to her liver. Want to know about alternatives to just chemo or and other than diet. Okay, I'm gonna have to call you and stuff. So after this and stuff, we need to talk and stuff, because I'm going through something and stuff, and I can relate. I'm just gonna let you know that, and I'll let everybody else know I can relate and stuff. So I got you, Shakari. I'm gonna definitely put my number out there somewhere, message you, look for my number and stuff so we can talk and everything. So Tony said, yep. And then yeah, I know, I'm like Sakari. Yes, Lake Peace, but also known as Sakari. And then Uncle Ricky said it's all about billing. Yeah, it's more than billing and stuff, because they're gonna bill you $1 million. One aspirin is $1,500 just because a nurse gave it. I'm like, I don't even get the $1,500. Why shoot all these pills out there I didn't gave in my lifetime and stuff? I would be a trillionaire, a godzillionaire. Yes, if it was that easy and stuff, but yes, and Mary and stuff, yes, definitely the praying hands, because we all going through it and stuff. It don't just it don't skip my family because I'm a nurse. I'ma just let you know that and stuff. And remember, because I'm a nurse, I'm also a patient. So I'm telling you to tell on them, because that's what I've been doing. And guess what? You get things done. You get respect, first of all, but you get a lot of things done and stuff. So this is, oh my God, and stuff. Now I'm going to start getting teary and stuff, because I'm saying all of this to say that you guys are coming with these good answers and a lot of stuff. If I don't answer it on live and everything, I will definitely look for your comments and stuff. And you'll see that I'll answer everything after the live is over with and stuff. Now I'll go back and I'll get you the best information that I have on it and stuff. But this is no joke at all and stuff. Sakari said, love you. Okay, praying for you too. Absolutely, Sakari. I'm standing in solidarity. I'm just gonna let you know that now and stuff. And Mary said, say that. That's right and stuff. But we're gonna get to the better side of it and stuff. And then there's another one more treatment modality. I just want to make sure it wouldn't be right to teach this without saying this part, and that's hormone therapy. And hormone therapy slows or stops certain cancers like breast cancer or prostate cancer. So these are some that of treatments and stuff, because they got scientists out there. Some of these scientists want you to find out what's happening with you, what's happening with your loved one, you know, and stuff. And they want you to be able to fight. So they're going to make it affordable so that you can get these treatments and stuff. And so that's what we got to use first. That's our first line of defense and stuff. Yes, they got, you know, our Dr. CB's and he's on point. That's why they be trying to silence him and stuff, like Mandela and all of them and stuff like that. But at the same time, we're not used to getting that, and we don't even get that quality of food, you know, that come with getting this stuff, like pure aloe vera, because the dirt that I'm growing a big old aloe vera plant that I've been growing for about 20 years now on my porch and stuff, and it got big old giant leaves and everything, and aloe vera is really a miracle natural medicine and stuff. But guess what? Even it is sitting in some dirt that I don't know what's in that dirt, you know, and stuff like that. At the end of the day, like, you don't know where your oranges really come from, your apples really come from, your papaya really come from, and everything and stuff. So could you imagine that? We got to vet out everything. Oh, we could get oil of oregano and stuff like that. But yeah, you could get oil of oregano. Do you know if they really putting that in the package, in the pill that you're getting? You know, so we got to look at all of that. Organic versus what we see on Amazon or eBay or Best Buy, I don't know, Walmart.com or whatever and stuff. Also, not sleeping on these vitamins. Vitamins cost. If you want the best, you got to pay the best money. That's why if you want the best treatments, you got to pay the best treatment money for them. So you could get away with that Flintstone vitamin for your kid, but really research what's really in it. That one a day, that Centrum. I'm not restricting any of these, because if you have to take that, then that's what you have to take. But just think about it. When you want something that breaks down, because I've been in contact with a nurse that's a gastrointestinal nurse, where they do the what is it called, the colonoscopies, where they go up inside your bottom area and stuff. And guess what? She says she finds the most pills. She could tell you every pill that you took, that Centrum, if it went in your mouth, went into your stomach acid, went through your small intestine, went into your ascending and descending and transverse colon and all of this stuff into your large intestine and came out in your poop, and it's in your poop and it's still whole, did you get the vitamins? So you see how serious that is and stuff. So that's what I'm saying. Watch what you putting in these babies. Watch what you put in yourself, because there is a difference between Tylenol and acetaminophen. Acetaminophen is the drug name. Tylenol is the brand name. But guess why Tylenol is so good? The actual Tylenol, you notice that it's more expensive than acetaminophen at the 99-cent store, because Tylenol got a patent on Tylenol. First of all, copyrighted Tylenol, but also they got a patent on how their medicine is formed. So the drug is acetaminophen, but Tylenol is going to have the best acetaminophen running. The way they put their pill together, they got rapid acting and all of that. Make no mistake, it's a reason behind that pill being so good. That Tylenol is going to go in. It's probably going to stop the pain within 10 minutes. Whereas that little 99-cent store acetaminophen that you bought, or that Kirkland brand acetaminophen that you caught, they can't call it Tylenol. They got to say it's generic for Tylenol or something like that and stuff, because Tylenol did already patent the best formula. So it's not a whole bunch of fillers in it and stuff. So you getting your straight acetaminophen, whereas that acetaminophen from the 99-cent store, you get a little bit of dirt with your acetaminophen. So you got to fight off the dirt. Where do you think our cancer come from in the first place? For our headache, and stuff like that. That's where that comes from and stuff. So Alicia said, when you travel out the country, you see how different the chicken look. Exactly. And how fresh it tastes. You be like, oh, is this a marbled chicken? Did it come from heaven or something? And stuff. It tastes delicious. Yeah. And where your little choked up chicken might have came from, it looked like, I want to die anyway. Eat me, put me on your plate or something. And you notice the chickens, if you look at Safeway or you look at Costco's or some chickens are super little and some are super huge. Well, probably them huge ones, ooh, this got a big old giant chicken leg. It almost looked like a turkey. Yeah, and they probably got some medicine in it that made it big so that it could look like a turkey. And so you see what I'm saying? And Uncle Ricky said, information is the best medication. Absolutely. Seek it at all times until you leave this place that we call Earth or whatever and stuff. It don't matter where you're going and stuff. Until you leave, seek it and everything and stuff. Also, Tony said, wow, cuz you making my game up with this information. Absolutely. That's what I need to do, because now you're informed. Now you're responsible. Now you are informed because you went ahead and sat here and listened. So now it's your obligation to help your neighbor that didn't get on. Help your cousin, help your brother, help your sister, help your daughter, help your son, help your everything. You know what I'm saying? And stuff. And now you're obligated. Everybody that's on here, now you're responsible for somebody or a whole bunch of somebodies, because you shouldn't have listened. Now you listen, now you in. Okay? I didn't jump you in. But that's why I said that I'm probably going to have to do a part 2, because I'm not going to get to cancer and its anatomy and stuff. But I will be glad to do that, because you got such good questions that I'm going to be able to address them on the next live and everything and stuff. But I'm going to finish up with a couple things and conclude, and then I'll be off of here. So give me about 10 minutes and I'll be done with you guys for tonight only. But I'm never done with you, because the body is too big to just leave it at this, and everything. We got so much more to talk about. Nutrition, how to read a label and stuff, vegan versus carnivore versus all these different things. Why we get cancer from the pesticides and stuff like that. And why are we so big? We're gonna talk about Ozempics and Trulicities, and don't watch out, and stuff. Even different things. I even taught them marijuana already and stuff. I'm gonna revisit a lot of things as I see the trends coming in and stuff like that. But I want to do a fun thing real quick and stuff while I got you guys engaged and stuff. It's called myth versus fact. And this is some type of way to get it done. Oh, look at James. He didn't came on. Exactly. He said, I remember when you started nursing school. No, you now look at you. Oh, yeah. He said, now look at you. A great listen. Thank you very much, sir. And stuff. Yes. So definitely um getting back to what we're doing is myth versus facts. And this is what people say, and then I'm gonna give you the fact and stuff. So the myth: cancer is always fatal. That's the myth. So be encouraged. Cancer is always fatal. That's the myth. Fact: many cancers are treatable and even curable if caught early. If caught early, they're treatable. Okay. Maria said, you're doing great. Thank you, baby. And stuff. And then myth: only older people get cancer. Only the old people get cancer. No, nobody young ever got it and everything, right? That's a myth. Fact: cancer can happen at any age. Any age. So if you get the little baby and stuff, I know y'all seen Shriners and all of that, Cancer Treatment of America and stuff like that. Anybody can get it. You got a human body with cells. There's always a mutant cell in us waiting to get in somewhere. So it can trash the system. Trash the system. It gangs up like this and forms a tumor. It's supposed to be like this, and then it does what it needs to do, and then it dies and goes on and makes room for other good cells to come in. When it's cancer, it replicates and destroys wherever it's at and tears you up and destroys you and stuff. So then we got myth: if no one in my family had cancer, I won't either. I said that's a myth, right? Okay, just in case y'all didn't, the people in the back didn't hear. Fact: anyone can get cancer, even with no family history. It starts with you, boo. It starts with you. That's how cold it is. Cancer, like anybody can get it, and stuff. I'm not prejudiced to nobody. I'm getting in wherever I can fit in. If I can get your little baby, I'll get that. If I can get your grandmother and stuff, I'm gonna get her. If I can get your mama, I'm gonna try to tear her up. You see what I'm saying? That's why we gotta be in the know. My business, I don't know if y'all see the CEO, it says, your body's a snitch, believe it. That means something. Your body is telling on you. It's trying to tell on you. Are you going to listen? Okay. Myth: cancer spreads when exposed to air during surgery. They opened her up and stuff, and it just starts spreading, and they just closed her back up. Have y'all ever heard that? I always wondered about that. I was like, is that true? Oh, my God. Let me tell you the facts and stuff. So myth: cancer spreads when exposed to air during surgery. Fact: this is a myth. Surgery doesn't make cancer spread. Cancer spread it because it was already spreading. It don't need no air to spread. All it needed was a cell to get in and keep on replicating itself and destroying the scene wherever it's at. If it's on 27th Ave, it's going to destroy 27th Ave. Then it wants to get to the 50s. It wants to get 51st Ave. And then they want to get to the 60s. They want to get 62nd. They want to get 63rd, 64th. So don't be fooled. It ain't no cancer around here and stuff, so it ain't going to happen. No, don't be fooled. And so Uncle Ricky said, from 1 to 100, sure, you're right. Amen. All right. So then one last myth: eating sugar feeds cancer. Who said that? Who said that? Okay. So eating sugar feeds cancer. Fact: Cancer cells use sugar, but so do normal cells. No proof sugar causes cancer. Come on, y'all. Now, diabetes is what diabetes is, right? And sugar in excess, because you need sugar in your body in order to move, in order to put one foot in front of the other. Your body and your cells in your body that make you move and are responsible for blinking, responsible for me talking and stuff like that. They need energy, and stuff. They feed off of it, and your body converts sugar into energy. It's the excess. It's one Twinkie versus the whole box in one sitting. You see what I'm saying? There's a difference. If you eat the whole box, there's probably a good chance that you're going to have a reaction that you don't want, aside from getting fat or packing on some pounds. So that's what that means. Auntie Josie said, can be treated. My aunties made it through breast cancer. 3 of my aunties, as a matter of fact. Yes, Josie. She said that they've made it through breast cancer and stuff. 3 different aunties have made it through. Yes, because if you catch it, sometimes even if you catch it late, they have so many treatments out there, they actually can attack it. It might not be perfect, but it might prolong your life a little bit more than just giving up and not doing nothing about it. My family don't believe in this and stuff. We don't do this or whatever. So I get that. But just remember that you're making that decision, and stuff like that and stuff. I can't speak on everybody because I don't know all the dynamics. It's ethnicity. It's religious purposes. It's all these different things and stuff. But at the end of the day, you never get another you. Another you will never be able to be born. Nobody will be able to replicate who you are. And once you're gone and stuff, nobody will be able to get in like you, and be you and everything and stuff. So with that being said, inform yourself. Get on podcasts like this that's speaking that truth and stuff like that. It's not the wherewithal. I'm just trying to inform you so that you could tell a doctor on it, make them work and stuff. It might be the difference between 1 year and 6, 7, 8, 10 years, and stuff like that. Make them work and stuff. Make them work with you and stuff. It's too many smart people in the world. I consider myself smart now, and stuff like that. It's too many and stuff. So I'm going to end with this and stuff. The prognosis, what to expect. Prognosis depends on these things: the type of cancer, the stage when it's diagnosed, the age and overall health of the person afflicted, and how well it responds to treatment. Because sometimes it might not respond to all the treatments they try. And then you got to make peace with that also. But wouldn't you want to try at least? That's all I'm saying, and stuff. Let's try and everything. And many people live long, full lives after cancer treatment. Early detection saves lives. Early detection. But don't get discouraged because you caught it late. Because guess what? Catching it is another battle in itself. And it's another work, towards at least increasing the quality of what they have left. So even if you can't, even if it doesn't look good and stuff like that, we all know that somebody else got the final say so. What is it? Where's my little God right here? And stuff right there and stuff. Somebody else has the final say so, our maker and stuff. So at the end of the day, try to be encouraged, but at the same time and stuff, some things are out of our hand because it might have happened to you yourself, or it might happen to your loved one and stuff. But at the same time and stuff, look at the whole picture. And always inform yourself, because you'll always beat yourself up. And just because you didn't know or you didn't listen to the body being a snitch and stuff, you can't beat yourself up. It's just that's what was going to happen. Until now, when you can come on and find somebody like me or others like me that are out there that are trying to tell on it. Tell on it. Tell on it. The body has a way of snitching on itself. You got a built-in microchip inside your brain that tells your body to tell on it. That's why you get a headache. That's why you get an earache. It's an ear infection. That's why you get a fever. That's why you get, you know, and stuff, because it's trying to tell. Cousin Tony said, good job. Thank you. Thank you for coming on. And Auntie Josie said, yes, my aunties are in their 80s and they caught theirs early and they're still surviving instead of the other way and stuff. And that doesn't negate the people that did catch it late. It means that you caught it. So now what can we do to make sure that that person lives out a peaceful, enjoyable life until it's time for their father to take them home and stuff? How do we do that and everything? So if you understand that, then you understand what I'm talking about and stuff. And so my conclusion, and then I'm getting off, you guys, and stuff, but I thank you for staying on, because cancer is too hard to just do in a couple sentences. It's no way and everything. But Kiki says, thanks so much, Nurse Charlene. Thank you. Thank you for coming on. Thank you for getting yourself informed so that you can help somebody else and help your loved ones. I appreciate you. And then Sandra said, beautiful job, Charlene. See you the same time next Tuesday. Absolutely. And good night. Have a good night and get peaceful rest. All right. And then Mary said, thank you, Charlene. Nurse. Y'all gonna make me cry. And so thank you, Charlene, Nurse Allen. I'm glad I logged in. This is so encouraging and inspiring. That was my whole point, to be able to encourage you while you guys, remember, I'm human too. I cry and get upset and get mad and everything and stuff. But while I'm going through it, see, that's the key. I'm going through it. So I made myself informed even more so and stuff. So that's the seriousness of it that just makes me just a little bit different. That's all. I'm on a different little plane, just riding this in and everything. But I thank you all for getting on. I thank you for tuning in. If you missed any of it and stuff, you can catch the replay. It'll be available right after the podcast ends, the live ends. And also you can catch me on YouTube under Medical Talk and Layman's Term with Nurse Charlene. And you can go back and look at other podcasts that I did on other subjects and everything. So now y'all really gonna make me cry. Cousin Maria said, you did your thing, cuz. Wonderful job. And Mary said, good night. Yes, Mary. And my Uncle Ricky said, who loves you, Bubbles? That's my nickname, you guys. It was Bubbles before it was Nurse before it was Nurse Charlene and stuff. And thank you, James, and stuff, sending the praying hands. I appreciate it. And I thank you guys and stuff. But I want to just conclude with this sentence. Cancer is not a death sentence. It's a disease. And like many diseases, it can often be treated and stuff. And then also just know the signs, get regular checkups, and don't ignore symptoms. Don't ignore it. Your body is snitching. Stop ignoring it, because that's how we catch it late, because it had to have did something and everything. Cousin Tony said, thank you, cuz. Good night. Good night, everybody. I appreciate you. And definitely tune in next Tuesday, where I'll be coming with probably part 2 of this subject and everything for you guys. And everybody take care of themselves. And remember, your body is a snitch. Believe it. It's telling you. All right. Thank you, guys. Good night.